Okay, we have Rosie here again, who, as you can see, is a dark Cocker Spaniel. We're going to go and show you how to go and do the shoulder and the elbow areas. Again here, looking at the machine, you're going to go and choose dog and dark colour. And then in this case, musculoskeletal, acute, obviously if there was an acute damage, or chronic if it's going to be a more chronic aspect in regard to that. In the case of here, you can see straight away that there is a shoulder setting here. And then when we go down, press the little triangle, you can choose the body size in regards to the actual type of animal and change it appropriately. If you start to see that you're not getting the success that you're wanting out of the K-Laser, you can go up a body size, and that's one of the benefits of this. So if you feel that at this size, after 2 to 3 sessions, you're not getting success, you can go up one body size and then give a little bit more power in regards of it. It's a very simple process. Once I do that, I can press on there, and it will go through into the shoulder setting, and you can see it's only about 2.5 minutes for a dog this size. So we're going to start treating Rosie in regards of the shoulder, and then we'll work down to the elbow setting for her. Okay, so again, pressing on the central thing there. I am going to use the main head in regards to this because this is going to be more high power, and therefore I want to dissipate the energy over a larger area. Okay, all right. So treating her now, I'm going to keep this in contact, okay? And it's going to be a continual motion. You've got to go and manipulate, because whether the dog's standing or whether it's sitting or maybe even lying, the position of that will be slightly different. And working with your vet team and your nursing team, you've got to work out exactly where you're actually doing it. But it's a continual motion over that period of time around the actual shoulder itself. Maybe if it's more of a biceps tendon injury, then you're going to be working more on the cranial aspect here. But maybe if there is a deeper musculoskeletal tear or something, then you're working actually over the central spine area, okay? But the continual motion of that will allow you then to go and dissipate the energy over a wider field. You can see there is no discomfort whilst we're treating over Rosie. And as I'm doing it, I'm just gently going and trying to go and push away as much of the hair as possible so that I'm getting as close to the skin surface as it can be. Here I've got Rosie and we're treating her elbow, and in the settings here, and I've got it under the chronic dark dog setting, I'm able to go down to the elbow setting, press the triangle, and now again choose the appropriate body size in order to go and do her. Okay. When we go into the setting again, a relatively short time frame of about 2 minutes, 2 minutes 12, and then when I actually press the final button there, it allows me to choose the head, and I'll always choose the large head in regards to this, okay? In her case here, I'll be able to go and work probably about 3 or 4 centimeters above and below the elbow itself. Again, feeling where the elbow is, making sure I'm not going to a wider area, and I'm going to work around it, and actually I will try and work medial to that as well. If she was laying down, I could obviously open her leg up, but with this I can just work from either the caudal aspect, or I can work around and work from the cranial aspect to go and get to that elbow and as deep as I possibly can. In doing that, again, in her case, I'm trying to go and push away some of the hair and trying to get as close to her elbow as possible. Some of you may be doing this straight after surgery, and in that case there, obviously it's nicely clipped. But again, as long as there's no wound there, you can do that in a contact mode. If there is an acute wound, you just leave a little bit of a distance and treat from a little bit above the actual elbow itself over that area until the wound is totally healed from the surgery itself.